Hi everybody, I hope you had a great summer. It's almost Labor Day, which means the unofficial end of summer here in Michigan, and I wanted to give you just a really brief update on what's happening with our two budget priorities. As we all know, this legislature and governor have not been able to come to an agreement on road funding, and so that has held up the budget process. New fiscal year for Michigan starts October 1st, and so that deadline is really looming closely. We're hearing in Lansing they are preparing for the potential of a government shutdown, but I know all parties involved would really like to try to avoid that. I can tell you the House and the Senate both passed a budget, and those budgets were rejected by the opposite chamber and sent to conference committees where they sit and wait for action until leadership can come to some sort of decision on that big piece of the budget regarding road funding. But there are budgets that have been passed, and there are a lot of little budgets that all add up to the big state budget, and the budget that we're concerned about is the Health and Human Services budget, and each chamber did pass their version of that. Just for a quick refresh, our two budget priorities are the Michigan Dementia Care and Support Program, which was included in the House budget with $400,000 funding to take the program to 8 counties, and a placeholder in the Senate budget. And the other priority is the My Choice Home and Community-Based Service Waiver, which we saw a 5% increase in the House budget, which was our ask, and a slight increase from the current year appropriation in the Senate budget. And we have done a great job. Our volunteers have been incredible when it comes to really working with legislators on these issues. I can tell you we've made a lot of new friends in Lansing working on these issues, including Representative John Hoadley from Kalamazoo and Representative Mary Whiteford from Allegan County, who is the chair of House HHS. We had a volunteer go to one of her town halls just a couple of weeks ago where she said she was going to see the My Choice 5% increase through to the end. And so I think we have a lot to be cautiously optimistic on when it comes to the state budget, and I want to thank everybody who's played a role, whether you came to State Advocacy Day or have responded to any of our alerts or taken action on social media. It's all added up and helped us get to where we are right now. So in that vein, this week you likely saw an email from Matt Phelan with an action alert geared toward the governor, asking the governor to support a 5% increase for My Choice. We're doing these messages to the governor in conjunction with a lot of coalition partners who are doing calls and emails into her as well. And that's because her people will be involved in these conference committee meetings in negotiating the final details of the budget. The goal is that the legislature will send her something that she will be willing to sign. So we just want to make sure that her office continues to hear that this is an important program, especially because her budget recommended an $8 million cut to the program. So I would ask you to please take action if you haven't already. And there's also a social share feature that is a part of that message. If you are on social media and would please share that link on Twitter or Facebook, that will help extend our reach and get more messages into the governor and will help make a big difference. If you didn't get that email, please reach out to Matt Phelan, MEPHELAN at alz.org, and Matt can send you a copy, and once you take action, you will receive those emails regularly from us. So that's what's happening with the budget. I think we're going to see a lot of action in the final weeks and days of September, so stay tuned. Thank you for all your great work, and we will keep you posted. Bye.